The mainstay for detection of prostate cancer is a combination of a digital rectal exam and a PSA test. These tests should be performed annually after a man turns age 40. Digital rectal exam is when your physician inserts a finger into your rectum and feels your prostate, trying to assess if there are any hard spots or nodules in the prostate. An abnormal hard spot or nodule may indicate the presence of prostate cancer. PSA stands for prostate-specific antigen, and it is a protein that's made by all normal prostate. It can be detected in the blood. Although PSA is not cancer-specific, it can tend to rise in men who develop prostate cancer. There is no absolute normal upper limit or value for PSA. Instead, the test should be used by following it annually to detect the trend or velocity in the PSA. A sharp rise in your PSA 1 year to another may indicate the presence of prostate cancer. Other things can cause the PSA to rise, such as inflammation or prostatitis, enlargement of the prostate. As men age, their prostate gets bigger and the PSA will naturally tend to rise. We normally don't like to see the PSA rise more than 0.7 nanograms per year. So if your urologist detects a nodule on your prostate or there is a sharp rise in your PSA, he or she may recommend that you have a prostate biopsy to detect the presence of prostate cancer. One important note in getting your PSA testing is you should try not to ejaculate 3 days prior to giving the blood test, as this can cause a 10% elevation in your PSA.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.